Shane Elks, and this is Creating Frequencies. Today we are going to talk about drama therapy. Drama therapy is the use of theater techniques to facilitate personal growth and mental health. You can use role playing, theatrical games, mime, puppetry, improvisational skills. All of this is used for things such as problem solving, to explore unhealthy patterns of behavior, also for interpersonal interaction. The main core of the process deals with something called projective identification, which allows you to explore and help define. The person is able to help define certain interactions and certain feelings and struggles that they have, and they're able to define them and express them by not being within themselves, by being able to project it out into a character or using a puppet or by having a mask on. They are then able to more explore what is going on the inside. There's also something called dramatic distancing, which basically is the same. It's for the same purpose, but you use metaphors in order to explore and explain and enter turmoil, or to find out what's going on inside of the being. There are many, as drama therapy has grown and evolved, there have been great pioneers of drama therapy that have brought it to what it is today. One of those is Augustus Bull, and he was a Brazilian theatrical practitioner. He is also was known as a social and political activist. He was actually banished and went to Peru and to many places that were war torn and poverty stricken, and he started a type of theater called forum theater, the forum theater method. And this allows the observer to become part of the theatrical experience. So an actor would, or actors would, begin on the stage and they would present a problem, and then the spectator would then become part of it by suggesting something that would happen in the action on the stage. This has now been used in great strides with those who are on the autism spectrum, those who do not have, who find it difficult to interact socially. For example, say someone who is a young adult and is on the autism spectrum, or is having has extreme social disorder. You would set up a situation where you're at a bar, and they would say, okay, so what would happen if I wanted to buy this person a drink? And you would act out the situation, and the spectator could continue with their concerns and see it play out, and it would help them feel more comfortable in that situation. Also, going for a younger child, someone who is maybe afraid to go to the doctor or afraid to go get their hair cut, or a dentist, and you could actually set up a fake, a play pretend doctor's office, and they could say, well, what would happen if my mom wasn't in there, or what would happen if it was too cold, or all these situations, and they can kind of play it out and see that it's not as scary as they think it might be. And then when they actually get into the social situation, they feel more prepared and are not as frightened. Going kind of back to the interpersonal interaction and exploring unhealthy patterns of behavior, dealing with the projective identification, I've many younger students and clients, I've noticed, feel they come alive when they are able to kind of put away that fear of being themselves or whatever they fear in a social interaction. So when they put a mask on or they're able to kind of live through a puppet, they are able to be a little bit more of themselves, and are more open to discuss or to explain um, some things that they're dealing with. If a child is doesn't know how to explain why they're afraid of the ice cream man, then you can one puppet can be the ice cream man and one puppet can be them, and they can say, hey, it scares me because the music's too loud, or they might not have even known that the music was too loud. And when they're talking, they can, as the puppet, because they're not experiencing it and because they're not having to actually be in the situation, they're able to project onto that puppet their feelings and explore more of exactly what is going on in their situations. Um, I I definitely invite you to explore drama therapy, whether you are a child or a parent, or you're a therapist or a teacher. There is a board certification for drama therapy. People use drama as therapy, meaning that they're not board certified therapists, but they have clinically researched and studied drama therapy. But whatever it be, whether you're in a community theater situation or you're in an educational theater situation, what have you, drama can be used as therapy in so many ways, and it helps many people, including, it goes beyond working with children and adults that are on the spectrum or have developmental disabilities or behavioral health issues. It also helps trauma sufferers, it helps addiction, those with addictions. It helps a lot of different situations. So I do invite you to explore it, and it's just one amazing way that the expressive arts can be used as a form of therapy. Thank you, and this has been Shane Elks with Creating Frequencies. Goodbye.